A follow-up meeting with civil society organizations in Kenya on the implementation of smart advocacy strategies on domestic health financing. How has the smart advocacy training conducted by the African Institute for Development Policy, AFIDEP, and the Partners in Population and Development, Africa Regional Office, PPD-ARO, prepared you to advocate for sufficient health sector's resources and improve efficiency? What achievements have you realized through this training, and what lessons can you share from your experience?
I think from the training, I've been able to gain strategies, knowledge on how to engage policymakers at the county level, that is the government, the county government, in terms of influencing policy direction, in terms of also engaging meaningfully in public participation to make sure that we achieve the desired results. Before the training, our approach as civil society organization, we are known for the activism approach to issues, demanding our agenda to be undertaken. But after the training, that approach changed. It was more of strategic engagement, engaging the decision makers, getting their buy-in, influencing them to see why we are pushing for this, why we are advocating for a certain agenda, and more particular in the health sector. And we're talking about the primary health care, financing and advocacy. And we've been able to achieve great things because we realized that they were ready to talk to us, given the new approach of employing strategies we learned from the smart advocacy training. We're able to engage the governor, the deputy governor, the speaker of the national assembly, the speaker of the county assembly, and the CECs, and we were able to get the quick wins. Were before, like in our county, we didn't have a RAMCA budget line, but as we speak now for this FY financial year 2024-2025, we not only have a RAMCA budget line, but we have also some allocation. It is literally but 650,000 to start with. I think it's a win in that we didn't have that vote line, but we now we have it, and we have an allocation. Number two, if you look at the allocation, the overall allocation to the health sector, there's also an increase also in this financial year. And in terms of involvement, inclusion of CSOs in the health sector governance systems, as I speak now, I'm a member of the health sector working group. And recently, we also got appointment of 2 civil society representatives from Taita Taveta to be part of the Taita Taveta County HIV and AIDS Response Committee. So those are some of the benefits we are benefiting as a result of this training. And we've also enhanced partnership with other strategic partners. As I speak, we are working closely with the AMREF and other partners in the county.
I attended the Smart Advocacy workshop last year in Nakuru. Penda Health operates outpatient facilities, which are 16 currently in Nairobi, and the focus is on primary health care. Our Smart Advocacy project, we work together with the Clinton Health Access Initiative, and the focus was basically to advocate for a timely reimbursement of the old Linda Mama, Edu Afya claims, as well as old NHIF claims. Since last year, we have seen a lot of transition from NHIF to SHA currently. In our project, we had several wins. We were able to get the 3 billion allocated by the former Cabinet Secretary of Health, Susan Nakuricha, to offset the Linda Mama, Edu Afya, and NHIF old claims to both public and private facilities. Additionally, we were also able to get a second tranche of 4 billion allocated to be able to offset the same claims. Following the lessons learned in the smart advocacy is leveraging on the associations. We are members of Kenya Healthcare Federation, Rural and Urban Private Hospitals Association, and HENET, which have been able to advocate and work closely with the other service providers to be able to collect the list or data of owed claims by NHIF and SHA. Additionally, lesson learned is in advocacy, never give up. Need to continue working closely with the influencers, messengers, and the key decision maker. As we continue making SHA work, or rather the transition is going on, we hope that we'll be able to have all owed claims under NHIF and SHA offsetted by SHA and the government at large, because this is impacting the health outcomes that the citizens are going to obtain. We thank AFIDEP, Population and Development Africa Regional Office, for constituting the different institutions who are able to participate in the smart advocacy training. This has been impactful, and we are really grateful to have learned who do you target during a smart advocacy initiative, from the key decision maker, and also the messengers, the influencers that you need to work with, and also tapping into stakeholders. We have also learned that evidence is key and data is key in smart advocacy. Thank you.
Smart advocacy has been critical in enabling us to come up with a very well-thought strategy of doing our advocacy, particularly domestic resource mobilization, which is health financing. Through smart advocacy, we have been able to see who are the key players in the health financing, who are our influencers, how do they work, how do we engage them, and also we have been able to build a movement with adolescents and young people from Kwale County when doing our health financing advocacy. Quick win for us has been being able to position adolescents and young people in critical decision-making platforms like the technical working group, also the youth advisory councils. So this has given us an edge for us to be able to amplify the voices of young people when it comes to their gaps in sexual and reproductive health, that is in terms of accessibility to these services. Remember that these services are critical in addressing the poor SRHR indicators that government from the national to the county level have been posting, that there is an issue with pregnancy, issue with new infection among adolescents and young people. So it's so remarkable that from the smart advocacy we were able to address the issue of financing that has gone to critically improving these indicators by designing intervention and funding those interventions by the county government.
I would talk about smart advocacy because smart advocacy has revolutionized how civil societies are engaging with duty bearers in the space. Because initially, we were deemed activists or people who just talk. But with smart advocacy, we have realized that a lot is being done. We are getting to decision-making tables and making valid contributions to make amendments that benefit the people. For me personally, smart advocacy has helped me know how to write specific messages or craft specific messages, identify key stakeholders that I need to target the messaging to, and have very clear asks that can guide the decision maker on what exactly we are advocating for. Some of the quick wins that we have gained as HENET has been recently in the year 2024, when there was vaccine stockouts, where we as civil society coordinators, we brought together civil society organizations that advocated for the release of 1.25 billion shillings that had been allocated for vaccines. The country was facing a stockout, and by writing dedicated letters to key decision makers and working in partnership with the media, we were able to amplify the voices of the people at the community level, the caregivers and the children that were not getting vaccines, for the treasury to release the 1.25 billion that had been allocated. Yes. Some of the key lessons we've learned is that advocacy takes time. It can take time or it can be a quick win, it depends. But it doesn't mean that you give up. If, for instance, you had an objective and it is not working, you work around other strategies on how you can achieve what you have anticipated for. But in case you didn't have an objective and an objective has come up, for instance, the vaccine stockouts, was not an objective that we had, but that was coming. It was an urgent and very important matter, and so we actualized smart advocacy at the time for us to be able to achieve our wins. So with smart advocacy it's a method of applying your way of doing advocacy for you to achieve your wins.
We've noticed that if you look at budget documents, issues like reproductive health, maternal child health, and family planning have very good narratives in the narrative part. But when it comes to allocations, you miss out that. So one, smart advocacy has actually helped us to, one, talk to government and be able to argue our case and let them see the need to make allocations for that. In Laikipia, over the last 1 year, we've been able to train about 30 people, supported by HINET, supported by other partners, in smart advocacy. Why? We want to actually have more people looking at issues from the same perspective, from the same angle, people who can be able to advocate for specific issues within their lane. While we work as a network, this network is working on specific issues. There are people working on youth affairs, there are people working on reproductive health, there are people working on climate justice, there are people working on budgets, there are people working on public participation, and bringing in synergies. And then the aspect of smart advocacy has helped amplify our voice as a Laikipia County Civil Society Forum, and as individuals from the specific organizations, from individual organizations at personal level and at organization level.
Advocacy has taught me to be able to be specific in who you are targeting and be able to specifically target what you want, so that you can be able to measure the outcomes of the advocacy. And one of the quick wins has been, especially for Nairobi, there has been a budget increase from the previous 8 billion to 10 billion. Although the issue we've had is the issue of a lot of budget, still more than 8 billion still going to recurrent expenditure instead of service delivery. But that's one of the quick wins, and also there's a quick win in terms of increased allocation for the RAMCA from 22 million to 34 million. And also there has been an increased allocation for primary health care from 22 million to 34 million. And one of the lessons learned is advocacy is a process, and sometimes you don't get the wins as what you had targeted, but partnership and collaboration is important for you, that in order for you to be able to get to achieve your goals.